Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live today. What a beautiful, beautiful Washington day. Finally, the rains have gone away and the sun has come out, and it's actually a very, very pleasant fall day. Reminds me of Western New York, where I grew up, except this time of the year you never know if the snow is going to hit. Nevertheless, I'm here to take your phone calls on any subject that you may want to discuss. We're here at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Perhaps you've had a problem, you've tried, you've applied, you've done everything you can think about. Well, here's an opportunity to discuss what can be done differently and actually might do something that would work. What a concept, right? You know, I spent the weekend with a group of doctors. I was teaching all day yesterday, Saturday, and these are doctors from all over the metropolitan area, and some from Southern Virginia and up in the upper portions of Maryland. And I was talking about in the integrative medical model, or the integrative natural health care model, and how you bring together multiple physicians looking at a singular problem and workshopping, grand rounds if you would, and apply a significant end product called treatment that actually works, and with the patient in mind, and it's called a patient-centered model. We've been doing that in our practice for many, many years. Now, with the recognition of the upcoming 2014, the Affordable Care Act, there's a lot of different, if you would, approaches, programs that you're going to start seeing come out to the marketplace. Many of you, your physicians, have said, well, the only way that we're going to see you now if you belong to what's called a concierge practice. And that's basically where you pay a fee to belong to the practice. The reason why they're doing that is because the projected reimbursement rates under the new federal system are going to be significantly lower, as already many people know that they are for Medicare reimbursement. So they're trying to figure out how to survive. And so what they're doing is they're saying, instead of having to see a lot of patients just to pay the overhead, we're going to see fewer patients, but we're going to charge a fee for them to belong to our network, our office. And for that, you get a couple examinations a year, and you have the ability to get into their office within 24 hours if you pick up the phone call. You may not see your doc, but you'll get into their office. Now, that's an innovative way of handling a lot of the things that are coming up. The problem is that it doesn't answer the entire story. There's another model out there. It's called patient-centered medical home. And what that's all about is bringing together, again, the concept of quality, affordability, health care to you, the patient. So if you get an affordable care medical home subscription, then all the things that you buy, all the things that you have to see the doctor for, all the prescriptions, all those things are contained in one area. These people sign up, and it may not be under one home, but nevertheless. So the patient-centered medical home is, again, it's a modern care concept that's actually a spin-off place with a lot of different innovations. A model of care that emphasizes the coordination and communication of primary care into, quote-unquote, what patients want it to be. Well, what does that mean? Well, you want to be able to have high-quality care. You want to be able to choose between acute care, put the Band-Aid on it, stop it from bleeding, and corrective care, really get to the center of the problem. You want to be able to transform your health from the way it is right now to something that is a wellness-based model, if you would. Okay, so clinicians and insurance companies and purchasers of goods and consumer groups, they're all getting together and they're developing these patient-centered homes as a proven alternative, supposedly, to this high-cost national fragmented delivery system, that we have in front of us right now. Well, having said that, the deal is that nobody really knows how any of this is going to work. There's a lot of models out there, and people are kind of grabbing at things. They're just, they're grabbing from here to there, and they're saying, okay, let's figure out, let's prepare. There's a lot of docs that are going out of business. Two good friends of mine down the road just sold their practice out to one of the larger conglomerates in the area simply because they knew that with all of the paperwork, they weren't going to be able to afford to stay in business, and that's unfortunate because these guys were quality people. Now, the ongoing situation is that doctors and hospitals and institutions and politicians and bureaucrats are scrambling because you're putting pressure on them. See, all of the complaining that we're doing and say, oh my God. So they're trying to develop an understanding of what this all means. And the truth of it is, as many of you found out, if you've gone to any of the exchanges to see what they're like, they really are not protective of your rights. They're not protective of your privacy. They're not protective of the things that you want to get done. It's a sad situation. Hopefully it's going to get straightened out. But in the meantime, the way it exists right now, after you take, you've heard trillions of dollars of increased debt. Well, here's the real fact on this situation. It's going to cost a whole lot more, and based on everything that I've been able to come up with, and we've been doing our research because, as a integrative care practice of chiropractors, acupuncturists, nutritionists, massage therapists, rehab specialists, we have to figure out how we fit into this loop. And, we focus on wellness care. We want to try to get to the bottom of the line to ask the question, why is that? Why is the problem really there? So we've got to figure out how we fit into this maze, this craziness. And, people are saying, well, we're going to lose our coverage and it's going to cost more. And, well, the truth of it is it will cost more. And after you knock out, all of the hyperbole, if you will, it's probably coming down to the first year of implementation next year. It's going to cost this country something in the neighborhood of about $580+ billion net cost coming out of your pockets. Our practice, for example, I've always insured my office, and we have 27 employees. I've always offered health care to my administrative staff, my doctors, and we just got noticed in last January in anticipation of this that our health premiums for our office was going to go up 36%. So we said, I don't think so. So we did some in-house finagling, and we increased our premiums. We do some in-house insurance, and now, last month, our insurance company called us again and said, listen, if you sign up now, we will only increase you next year in 2014 24%. So I looked at it and said, there's got to be a better way. There has to be something else. So we're going to finagle around that, and we're going to do more in-house insurance and so forth. But for us, where we're not even bound by the law, we could tell our staff, listen, go out and get your own insurance, right? Here's a couple $1,000s a year, and, go see what you can get done. We feel it's our obligation to make sure that if we're providing health care to you, we need to provide excellent quality health care to our staff as well, and we're trying to get that done. But you need to know a lot of different things. And the only reason in the second half of the program, or late on the program, we're going to talk about an interesting paradigm, metabolic syndrome, and what your blood fats are and how they apply, why your inflammatory levels go up, what happens with an injury pattern. We're going to touch on those things. But I want to touch on this because, again, I spent yesterday with some really great doctors, people who have your best interest at heart and are wanting to learn how to put together a model of healthcare that makes sense, that they can educate you, that they can support you, that they can help you along your medical health, your wellness health, to make a better life for you, your family, and your children. So your healthcare is going to change anyway, even if you keep your private insurance. We heard from our president that if you like your insurance, you can keep it. Well, eventually, most remaining plans, whether they're employer-based plans or individual plans, will have to conform to the federal standards that are sitting there. There's a punch list. Bang, 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 right? Well, moreover, the necessary plan upgrades will undoubtedly cost you a whole lot more. Whether you want them or not, you're going to pay for them. Now, for this plan to work, or any kind of federal-based insurance plan to work, everybody has to be all in, from birth until death. So everybody pays a premium, and a higher premium. Young people, middle-aged people, older folks. We all have to pay. So subsequently, it's going to be an increased cost all the way through. Higher taxes, absolutely. Proposed surtax on wealthy people. Included, there was a House bill, if I can, and I'm going to quote it to you accurately. It was House Bill 3200. Actually hit hundreds of thousands of small business owners who were dealing, with the problematic recession, that we've gone through. And if it's enacted completely, America's top earners and job creators, guys like, me, I hire 27 people. And there's people down the road that hire 15, people that, hire 4 or 5. What's going to happen is that these business owners are going to be nailed with much higher taxes, carrying a larger burden than those who've provided socialized health care of Italy and France and Great Britain and so forth, with a total average tax rate greater than 52%. 52%. And if you don't think that's going to be burdensome, if you don't think that's going to shut down businesses, think again. When most small businesses work on very, very narrow profit margins, they're going to be essentially put out of business. So where this is all going, I don't know. But everybody's struggling. Everybody's trying to put it together. Why am I taking time from Dr. Tom Roselle Live to talk about this crazy, silly thing? Well, I'm one of these nutcases that when the bill first came out, the whole 2,700 pages of it, we downloaded. I was so angry because I had to do briefs to different medical organizations that I actually took 6 months and read it. And the problem is 2,700 pages, but it's compounded by the fact that it relates to other pieces of legislation that has already in the past been put into implementation. So not only do you have to read and understand the bill, but you also have to know the other pieces of legislation and know how they interrelate. They don't even know the application of those pieces yet. So it's a bailiwick that we're all going to get consumed by, and the end product is we don't know. And, I sat there and I got angrier and angrier. And when you read some of this stuff, you can get all jacked up. But as a doctor, we have a mess in this healthcare system. There's no doubt about it. Absolutely no doubt about it. It's a mess. There are people who need to be insured. Well, as a physician, as a doctor, as a chiropractor, I believe that healthcare should be extended to people, but it doesn't have to be mandated to do that because there are other pieces, other ways of doing that. We have a foundation. Many of you know about it. It's called Caring for Others. And I started that in December of 2000. And we actually had begun to develop it in 1998. And what that does is we go out and we provide scholarships to young people that are going to integrative and alternative healthcare schools. We provide health care to those who can't afford anything. We provide public information and services to others and so forth, and it goes on. But that was something that we did, and there's many like us who do that sort of thing. I'm not saying that to you to tweak it to say, oh, look how great in what we're doing. I'm just saying to you that there are other methods of making sure that people are viable and have the health care. But the system as it is, the bureaucracy behind the medical system, the high costs of medications are obscene. I mean, in many cases, when you go to the drugstore and you fulfill a prescription from your doctor, your markup charged to you in so many cases is in excess of 2,000 to 2,500% of the cost of producing that medication. Now, I just want you to sit back and think about that for a second. Is that what it really takes to deliver that to you? I'm not sure. I'm not sure that's all in. But you have to understand that there has to be another way, because this system, the way it is written right now, is going to break the bank. So we have to sit back, and when we come back after the break, we're going to talk about other more important things. We're going to talk about your health. We're going to talk about the way your blood pressure and your cholesterol and so forth kind of break you down. But I'll be right back. Don't go away. You're listening to Dr. Tom Roselle Live.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yes, we're in studio. It's beautiful outside, and, you need to go out and take a walk and enjoy the day. But after you get done listening to us, we're here for your information, bringing you the most intimate information that we possibly can on integrative care, giving you options to your health. Give us a call at 888-630-9625, 888-630-9625. Love to talk to you on any subject that you have in mind. I've got several things I want to cover with you, and one of the things that we're going to talk about is something called metabolic syndrome, and a lot of you have heard that term. It used to be called Syndrome X, and what does that mean? Well, in a general scheme, what you see with this type of patient is you begin to see blood pressures starting to creep up a little bit. You start to see blood sugars starting to creep up a little bit. You start to see blood fat starting to creep up a little bit. And what that's all about, that's called stress. And it's stress from injury patterns. It's stress from all the things that you're shoving in your face that shouldn't be there, things you eat you shouldn't, things you need more of that you don't get enough of, things that you absorb, things that you bring in exogenally. And the one thing that we love to do around this area is stress, because we watch the talking heads, we listen to the talking heads, and we stress like crazy, and, we just let our body go down the tubes. I don't think we understand and we realize the power of the brain and how it affects the body. I was lecturing to doctors yesterday, and so many of your physicians and the doctors that I deal with on a day-to-day basis, not all of them, of course, but they look and they compartmentalize situations, and they don't ask the question why something actually exists. And in this situation, when you're dealing with a metabolic problem, means in this situation it's all over the body, everything is breaking down, nothing's working the way it's supposed to. But it's probably the most pervasive condition that we have in this country. It affects approximately 2 out of every 5 adults. 2 out of every 5. That means life isn't so good, my friends. You are starting to go down the tubes very quickly. 2 out of every 5 of us. So what is it? What really is metabolic or syndrome X? Well, I'll give you a definition. The American Medical Association said that anyone that has 3 of the things I'm going to give you, and I'm going to add a couple more of my own on top of this. If you got a waist, guys, that's bigger, or ladies, bigger than 40 inches, okay, particularly in guys, ladies, 35 inches, you got a problem, okay? Your triglyceride levels are above 150. Your good cholesterols, your good proteins are less than 40. And ladies, for you, that even goes down to less than 50. And your blood pressure is 135 or 85 or more. And your fasting blood sugar is 100 milligrams or more. Now, there are other markers that will measure inflammatory responses, and those go into this matrix as well, because that answers the question why this is. The central issue in Syndrome X, or metabolic syndrome, is really controlling inflammatory response that affects blood sugar handling and the blood sugar transport system. One of the ways that we measure that is with something called A1C hemoglobin, which most of you guys won't do for whatever reason. But what causes this? The primary cause of metabolic syndrome, syndrome X, is simply poor diet, especially high consumptions of refined carbohydrates and sugars that rapidly convert and break down into blood sugar that can't be utilized by the body. And it contributes, across the board to so many different diseases. Metabolic syndrome, stress, lack of exercise, mineral and vitamin deficiencies, chronic pain patterns, over-the-top, same old day-to-day type of things. Your diet is out the door. The body loses its ability to normally metabolize carbohydrates, and as a result, more and more insulin is required to do the same work. So it's like you're constantly flexing your arm, you're bending your arm, you're bending your arm, you're bending your arm, but you need to do it more and more to do the same job. This is what happens to any organ system in the body. Subsequently, what takes place is fatigue, a fatigue resistance pattern that starts occurring, and that, my friends, is something that you know about. It's called insulin resistance, and you don't have to be a diabetic to have a resistant pattern, but sooner or later you will become diabetic. So we have to look at all these pain patterns that we put up with and go to the store and we take all these NSAIDs, and they're not doing anything, actually making the pattern worse. Weight gain is the most noticeable. Blood pressure goes up, hardening the arteries, fatty liver disease, inflammatory pathway problems, and also guess what happens? Your kidneys start breaking down. You see, when you're on a blood test, you'll start seeing your it's called glomerular filtration rate begins to become less, and that should be quite high. You should be pushing fluid through your kidneys at a certain level, and that begins to slow down. So there are additional connections in the hormones. So when too much insulin occurs, particularly in men, it leads to dampening testosterone. Your feel-good hormone, guys, goes out the door. It doesn't work anymore. So subsequently, if testosterone's out the door, you have no drive. You have no want to really do anything. Your certainty goes away. Your strength goes down. Your libido is shot. You can't maintain activity in the bedroom anymore. That's all because of all the things we've been talking about up until now. So you see triglycerides starting to go way up, and they block something called leptins, and those are things that tell the brain that there's enough food, right? So you just want to eat. That's how you kind of put the fire out and relax and so forth, and you get bigger. Cortisol level, the stress hormone, starts cranking way up until it crashes as well. But it does it at the expense of your muscle mass. So when cortisol goes through the ceiling, it eats you up. It destroys your muscle mass, ladies and men across the board. But we need to know how to fix this thing. We need to know how to put it into perspective. So, one, you don't get there. Because, I was telling these doctors yesterday, and a lot of them looked at me and said, where'd you get that research? That men today in their 30s have the sperm count of guys who were 60 in the 1950s. That's not okay. We're going to talk about that. We're going to take your phone calls. 888-630-9625. That's how you get to me. We have some people holding. I'll get you right after the news. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am here to take your phone calls, 888-630-9625. That's 888-630-9625. Love to talk to you. It's a beautiful day outside, and we're all going to go out and enjoy it in a little while, but make sure that you listen first so you can get all the information you can to make it healthier. We have several calls. I want to get to the phones, and I want to start with Nick because we may be on topic. Nick, how can I help you? Thank you for calling.
Hi, good afternoon, Doctor. How are you today?
I am great, my friend. How about yourself?
I'm doing well. I'm getting ready to run a relay race next week down in Tennessee. And while I run regularly and run pretty good distances, I still have some concern in the back of my mind about potential injuries of running multiple legs in the same day. I was wondering if you had any advice on how to avoid injury.
Well, let's talk a little bit about you and the race. First of all, what type of a relay race is it? Give me the parameters.
Sure. It's a 200-mile race. There's 12 people on the team. And on paper, I'll be running 3 legs. The first one's 8 miles in the mountains. The second one is about 7 to 8 hours later, and that's another 7 miles. And then the third one is another 7 to 8 hours later, another 8 miles.
Okay. So you're going to basically run a marathon. Or pretty close.
Yeah.
Yeah. Okay. So breaking it up like that is a good thing. And so how old are you?
33.
All right. So you're 33. What's your body weight?
I am at 209.
Okay. Do you know what your body fat levels are?
I haven't had a caliper test in a long time. I've got a scale
Okay.
that does the electric test through my body. It says 21%. I'm 6'2".
Okay. So let's use that number. If you're at 21%, you've been training badly, okay? Because as a man, and if you're a conditioned athlete, you should be somewhere, but at the top end, you should be no more than about 13-14% at your age. Actually, if you're super conditioned, you'd probably be somewhere around 8, 9, 10, 11% in that area. So
I'll be the first to know I'm not super conditioned.
Okay. So do you know what your blood pressure runs?
My pretty normal range. I would say 110/70. If that's
Okay. So if you're 110/70, again, do you know what your resting heart rate is?
Boy, I haven't done that in a while.
Okay.
No, I don't.
All right. So there's a lot of things there that you need to know about, and actually to make good decisions. So I'm just going to broad brush this. So you're going to you're doing an endurance race. And it's if you were getting ready to train for the race, I would give you other parameters. But you want to make sure that one, you're extremely well hydrated, and if you're out running, actually Gatorade and things like that are not the best thing because your first 3 ingredients is sugar. It's not the old formula that they put together in Florida, to sustain their athletes. Here's something that you can do: you make your own hydrator. You take a liter bottle, and in that liter bottle, you put about 6 to 8 ounces of organic apple juice, and you can put maybe a teaspoon of honey in there with it. Then you put 1/8 of a teaspoon of sea salt, not regular sodium chloride, but sea salt.
Okay.
And that's going to be the best hydrator you can begin to imagine. It'll sustain you very well. And you can put that on a Camelback if that's allowed in your race, and
Sure.
you just keep sucking on that as you're running around. Do that on every leg of your race, and you'll find that will help you dramatically. You're going into it, you want to make sure that you are burning fat and converting it into sugar so your body can use it appropriately. My guess is that your training mechanism has not done that well simply because if your body fat level is at what it is, and we're guessing, obviously, we don't know for sure, that you've kept your anaerobic rate well too high in your training mode, and you're not doing aerobic challenges to get things squared away. There's a couple guys that you may want to look at. One is Phil Maffetone, Maffetone. Phil is an old friend, and he's trained elite high-endurance athletes his entire career. And there's another guy called Stu Middleman. You can look them both up online, and there's a lot of things there that they will provide for you in a step-by-step fashion to be able to train for this race. Now, this race is when?
It starts Friday.
Okay, this coming Friday. So, do you take any supplements? Do you take any nutritional products?
I do. Yeah, I take multivitamin by Optimal Nutrition and do a post-workout protein shake. I run about 30 to 35 miles a week. So.
All right. So the first thing to do is go out and get yourself a good magnesium glycinate.
Okay.
And start taking, as an athlete, as a runner, if you don't have enough magnesium, enough minerals in your body, you're going to start cramping up, your muscles are going to easily fatigue, and you're not going to be able to go the distance. Because calcium all by itself causes muscles to go into spasm, causes them to go into tetany. So I would encourage you to take about 200 milligrams of a magnesium glycinate 3 to 4 times a day as you prepare this week going into that race. And make sure that your protein levels are very adequate and you're getting highly assimilated proteins. At least at your weight and so forth, you need about 150 grams of protein a day in divided pieces throughout the whole day. Now, all kinds of things. Do you know what your blood type is?
O negative.
Okay, so lean meats and free-range meats and organic free-range chickens and vegetables are your friends, tons of it, sweet potatoes, things like the small cut brown rices. Stay away from from bread, from wheat, anything that is glutinous. Fruit is okay as long as it's organic. So as you get closer to the race, right now you want vegetables, you want proteins, you want some carbohydrates, but slow-release stuff. And then as you get closer to that race, then you're going to change that. But if you go online to those websites, it actually will give you a step-by-step guide. If you don't find what you want there, get a hold of me at rosellecare.com. Send me a note, and I will get back to you with some specific things. I'm going to ask you some more questions relative. I wish I had talked to you a month or 6 weeks ago. We train a lot of endurance athletes and probably could have helped you more. But at least that's a guideline. That's a beginning place for you.
I appreciate your help.
You're welcome. Good luck, and let me know how you do.
I will. I'll give you a call next week.
888-630-9625. Love to talk to you. Sheila, thank you for hanging in there. How can I help you?
Yeah, my question seems so insignificant, but I keep seeing ads on TV everywhere my hair is getting thin, to improve the growth in my hair.
How old are you?
80.
Okay.
But it started long before that.
Okay.
And I did send for something, and it's just the normal vitamins, all the vitamin B, salt, palmetto powder, I think it said, biotin, folic acid, collagen, and a bunch of other things. I don't see that it does anything.
It's probably not going to work for you, and let me tell you why.
Yeah.
At your age, and once a woman starts going through menopause, if her adrenal fight-flight system begins to be challenged, then she's not going to produce the hormones that she should. And it's the balance of estrogens, progesterones, and so forth that are going to maintain your hair density. So you've got to look at the HPA axis. You've got to look at the adrenal system as it stimulates the hypothalamus, which stimulates the pituitary, which controls thyroid, and so forth. If your inflammatory levels, for whatever reason, whether you're eating things that your body's sensitive to in any way, they create a barrier so you can't transport a lot of these things. Zinc deficiencies will cause some problem with hair loss. Pantothenic acid will as well. Biotin is a substance when it's low. It will additionally. But you've got to take enough of them if that's the case. But in your situation, where I would start with would be with checking out your hormones, checking out the circulation to the head, and all those things. And that can be neurogenic, neurological. It can be a combination of those things. But I doubt very seriously, Sheila, that at your age that those vitamins that are going to help strengthen hair are going to do you much good without first paying attention to the underlying problem and finding out what those things are and fixing that. Your voice sounds like you have good vitality. You're strong. I would encourage you. That's the way to go.
All right. Thank you very much, Doctor.
You're welcome. Thanks for calling. 888-630-9625. That's 888-630-9625. Love to talk to you. No question is insignificant. It's something like that. I mean, there are vitamins for everything. That's the beauty about Fifth Avenue marketing. You can, try something on some person, and all of a sudden it works, and you say, "Oh my gosh, this, let's market it as that." You have to be very careful. You have to look at, as they say, the rest of the story and what's happening metabolically in your own life. We go through changes in our life, and the truth of it is that we should, light up like a beautiful candle when we're born and continue our life until the day that we leave this planet and just kind of go out. But we wax and we wane and we break down, and it's because of the stresses that occur structurally, chemically, emotionally over a period of many years. So the point of it is that you really have to understand where you are in life, what you've done, what your timeline looks at. What have you been doing to yourself that maybe you shouldn't have done? All these things are cumulative. What have you not done that you should have done in support of your health? What are your stresses like? All those things burn up nutrients. And sometimes replacing the nutrients work very well, but you have to take them at an optimal level. They have to be balanced and combined properly. But it comes back down to what we were talking about earlier with the metabolic syndrome pattern. You've got to get rid of pain. You've got to make sure the inflammatory levels are low. You have to learn how to avoid the stress patterns. You have to be able to proactively be your own advocate in a way that you're willing to go to the why is that, the basic underlying principle of why your body's breaking down and whatever the symptom happens to be. So can you restore health? Can you restore hair? In some situations that you can. Obviously, those of you who know me, I have a genetic loss hair pattern, and mine ain't coming back. That's just one of those things, unless I go get transplants, and I'm not going to worry about that. But people who have thinning hair usually as a result of a prolonged stress metabolic condition that has to be identified properly, and not just treat the symptom, but treat the underlying substance, the terrain, the ground that you're growing this in. It's like going out and expecting to put new seeds in bad ground. It's still not going to grow. It's not going to work. You've got to fix the ground. You've got to make sure the ground has the nutrients and the minerals and everything that it needs, and then stimulate the growth by doing whatever that you're going to do. So there's a why is that. Remember, you can always get a hold of me offline by going to rosellecare.com. That's ROSELLECARE.com. And by the way, go online, check it out. We've got some new things on there for you. Aquasana's water filter company. We've been able to get 20% off for you from the company. All you got to do is go click on, and they'll get it done. We tried to make sure that we have some of the best products. We go very slowly. We don't put anything out there just because we want to put something out there. Those of you who don't have a copy of my book, you need to get it. We're going to talk a little bit more about metabolic syndrome. We're going to talk a little bit more about what your cholesterol readings, your tests mean. But in the meantime, I've got less than 2 minutes. I want to take a phone call. Barbara, thank you for calling. How can I help you?
Hi,
Barbara.
Dr. Roselle.
Hi. Yes.
I'm calling on the heels of Sheila, who just called your show about her hair and thinning hair, and you were going into the whole thyroid, adrenal issues. And having had a long history of thyroid issues, pituitary hormone issues, and all of those things connected, is there a possibility that the damage left untreated for a prolonged period of time is an irreversible type of damage, or does it lead to other more devastating and life-crippling diseases?
Okay, let me make sure I understand you. When you have a condition, any condition that has been protracted over a long period of time that you fail to do anything for, can it lead to permanency? Of course, absolutely. There are things that reversibility depends on how much time you have left on the planet, how willing you are to dedicate yourself to what you have to do to get done, and whether or not there's been any underlying structural deterioration that can't be reversed. That's very rare. 80% of things can be turned around providing the patient is willing to step up to the plate. There's things like the thyroid. If you've been on thyroid hormone for a long period of time, the thyroid will in fact stop working, because it's the if you don't use it, you lose it type of thing. So if you're replacing hormone and the thyroid doesn't have to try to produce its own, then it doesn't have to do it anymore. So it gets lazy, and then pretty soon cells begin to deteriorate, and it's that reverse situation. You break down faster than you build up. But in all situations, there's a lot that can be done to be supportive, to be helped, to move things forward. But you have to look at the neurology, you have to look at the energetics, you have to look at the terrain underneath it all to be able to fix that. I hope that, in the limited time that we have helps a little bit. You can get a hold of me, as I said before, rosellecare.com. I'm happy to go more into detail for you. Be right back after some very important messages. This is Dr. Tom Roselle. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We're here every Sunday at 12 noon, bringing you the most amazing, intimate, and up-to-date information on integrative and alternative healthcare. That's why I'm here. That's why I do this program, to try to help you, to put you in a different direction, to get you to think that there might be something else that you can get done. We're not going to be able to get into all the pieces of cholesterol, but we're going to save that for another show. I promise you I'll get back to it, but there's a couple callers. I want to take at least one. I think it's an important call. Frank, you're calling from West Virginia. Welcome to the program. How can I help you, sir?
Yes, sir. I had a CT lung scan done back in August. University Hospital here where I live had a special for $99. There's several people in my family have had lung cancer, and I've often thought about having that done. And the results were a nodule in my right lower lung and calcified plaque in my coronary arteries. So right away I thought I should go get a biopsy and catheterization. But my internist, when I was sending the results, didn't seem too concerned about it. Said just follow up every 3 to 6 months. So I wondered what you would advise for that.
Frank, where do you live in West Virginia?
Charlestown, Eastern Panhandle.
Okay. So there's a lot of things that you need to be doing nutritionally and metabolically immediately, but most medical tests don't show it. And it goes back to what we were beginning to talk about relative to the type of cholesterol findings. Unfortunately, when they do plaquing studies traditionally, they're only going to do total cholesterol, LDLs, HDLs, VLDLs, and triglycerides. There's so much more than that to tell you whether or not something is happening. And you got to look at the mineral balances. You have to look at your exposures. What type of work have you done over the years?
Well, I'm retired now. I was a clerk, retail clerk for 30 years.
Okay, were you a smoker?
I quit about 20-some years ago.
Okay. So even quitting that many years ago, are you around people who smoke?
Occasionally, but not very much.
Okay. So what I would...
Very frequently.
Okay, what I would suggest that you start with right now is you need to see somebody like us that does the kind of integrative work that we do to begin to get a baseline to find out, what your metabolic patterns are, what your real cholesterol is, your apolipoprotein A, apolipoprotein Bs, the high-density, small-density molecules. You need to see what your dietary patterns are. You need to see, what inflammatory barriers may be involved in the system, what your testosterone levels is, and so forth. All those things are critical in being able to do something. If you were pathogenic, if there was actual pathology, then I would refer you to American Cancer Hospitals and have them begin to work you up. But you're at a place right now that you can do some other things and you can become very, very proactive, but you need somebody to guide you. I don't know anybody in your area that does that type of work. You're welcome to give us a call. More than happy to guide you through that. You can get a hold of me at drtomroselle.com. and send me a note, and I'll take you through that way. But anyway, Frank, that's the best I can do right now. We're coming up to the end of the program. I wish I could help you a little bit more on the subject, but I need to know a whole lot more about you. It's not just a matter of do this, but you need to have some specialized integrated tests. You need to look at your adrenal function. You need to look at enzyme patterns in your body. You need to look at inflammatory markers. All those things are going to be critical to be able to help you and turn this around, but it can be done. We're coming up to the end of the program. Unfortunately, it's way too short, as always. We'll be here next week, same old place, same old time. I'm here for you. Remember that. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give